Good afternoon and welcome. I'm Deborah Olson, and I'm the Associate Dean for the School of Public Health, and it's my great pleasure to host the Teaching and Learning Series. This series is sponsored by the Academic Health Center at the University of Minnesota, as well as the future initiatives at the School of Public Health. We at the Academic Health Center had determined long ago that we as faculty needed to learn how to teach, as well as teach how to learn. So this series was sponsored by our education deans, as well as funded from our HRSA and our CDC colleagues from the Midwest Center for Lifelong Learning and Public Health and the North Central Public Health Leadership Institute. This is the fifth of the series, and for those of you who have been with us or who have viewed the series online, because they are available by a webinar, you know that the first of the series took us into a whole new world of technology-enhanced initiatives with Curtis Bonk, who taught us that the delivery of teaching and learning is changing and looking different worldwide. We also then had the pleasure of having David Rock with us to talk about the neuroscience of change. And then our own Aaron Doring, who took us on adventure learning to his lands in the North Pole and beyond, where he brings students with him on his teaching and learning adventures. And then Dr. Jamie Lester discussed building bridges across the professions, promoting successful interprofessional collaboration. All of these themes are most important to us as we seek integrated leadership across the globe, which is part of our theme for today. Today's session, Integrative Global Leadership, Leading Across Boundaries for the Common Good, features Dr. Barbara Crosby. She'll be discussing how leaders can bring together diverse groups of people to tackle shared problems and to achieve the common good. After today's session, we hope that you all will go away with an understanding of some of the essentials of leading across different sectors, cultures, and geographic boundaries. Identify elements of the common good, connect insights for particular cases, and ideas for your own personal practice. In a few minutes, I will be welcoming Dr. Crosby to the stage. However, it's also my privilege to take care of some of the logistics. So please bear with me. When Dr. Crosby completes her presentation at 1 o'clock, we will take about 5 minutes in which we'll be resetting the stage for our panel discussion. It's during that time that we would ask that you, on index cards, write any questions that you might want both Dr. Crosby and the panel to discuss. Our staff will be picking up those index cards as they come down the aisle. Also, for our webinar viewers, because I want to acknowledge another group of viewers today, not just all of us who are here privileged to be in this warm, beautiful Cowles Auditorium in the Hubert Humphrey Building, but those throughout the world who are joining us through technology. And our webinar viewers can also participate in providing questions by clicking on the balloon icon on the upper left-hand side of their screen. They can key in their questions and comments using that technology. Due to time constraints, we know that we might not get to all of the questions, but I know our panelists well, as well as Dr. Crosby, and we will do our best. At this time, I'd like to introduce today's speaker, Dr. Barbara Crosby. Dr. Crosby is Associate Professor at the Humphrey School of Public Affairs, University of Minnesota, and she serves on the steering committee of the university's Center for Integrative Leadership and was its academic co-director from 2008 to 2009 and part of the founding group as early as 2006. Her vision has carried the center forward. She also has taught and written extensively on the topics she will be sharing with us today on leadership and public policy, cross-sector collaboration, women in leadership, and media in the public policy. She's author of Leadership for Global Citizenship and co-author with John Bryson of Leadership for the Common Good, Tackling Public Problems in a Shared Power World. And she's Associate Director of Leadership Quarterly. The last time Barbara and I met for conversation was at a little coffee shop not too far from here. And I asked her at that time to share with me some of her impressions on what women in leadership and what we'll be hearing about today, integrative leadership, means. Well, at that time, she was getting ready to go to London for a sabbatical. She worked with the Leadership Trust there, and I asked her what she brought back with her from that experience. And she said a renewed outdoor spirit, because she's going back to camping, which she hasn't done for a long time. So she's taught input on leadership and integrative leadership across the globe. It also sounds like she came back with personal beliefs in taking care of her own person as she continues to lead us. So please join me in welcoming Dr. Barbara Crosby.
Well, thank you, Deb. Thanks to Julie Alcorn Webb and everyone else who's helped prepare this event today. Really pleased that you all could come. I don't think I'm competing with very good weather here in Minnesota today, but really appreciate both those who are present here in the auditorium and around the world tuning in through the webinar. Also wanted to recognize that we've got some distinguished panelists here who I'm counting on to fill in the guaranteed gaps in my presentation and knowledge. So thanks to all of you too. As Deb said, I've been a part of something called the Center for Integrative Leadership now for about 5 years. And this got started because faculty here at the Humphrey School, the Carlson School of Management, and other schools and departments here at the university really realized that the complex challenges in our fields required an integrative approach that brings people together across various boundaries. These can be sector boundaries between business, nonprofit, and governments, and community and media. It can be cultural boundaries, it can be geographic boundaries. A lot of us were also very interested in how one understands, promotes, develops leaders to actually do this work. So, as Deb said, we're going to cover these learning objectives today, and I certainly believe in truth in advertising. This is what we've brought you here to do, and so while everything I do today is going to be, let's say, just touching on the highlights of global integrative leadership, we'll certainly try to give you some ideas that you can take away and apply to your own practice. So that's my goal for today. As we look at this work of global integrative leadership, I think it's exciting work. I think it's daunting work. And, you know, by the time we ratchet up to the global level, it's even more daunting. So I want to just do a little audience check, at least the people here in the audience. How many of you find the notion of global integrative leadership daunting? Oh, quite a few hands going up. How many find it exciting? All right, about the same number. And how many just find it sort of puzzling? All right, at least a couple of hands. What I hope we can do is make it far less daunting and more exciting and a lot less puzzling today. Just, you know, hoping that you can imagine how global integrative leadership can maximize your efforts to have healthy communities and, you know, eradicate disease around the world. So I also think that actually public health professionals, I know not everyone here is a public health professional, but you have something of a head start because you are naturally integrators. You think about integrating physical and mental health. You think about the connections between people and their communities, their neighborhoods, and you're also very well aware that diseases and health issues spill across all kinds of boundaries. So I definitely think that you have a head start. So let's think about the definition of integrative leadership. And my colleagues here, like Joanne Dish and Will Houston, have been involved with the Center for Integrative Leadership. Probably might have their own definitions, but this is the working definition that my colleague John Bryson and I have developed. And this is leading across various kinds of boundaries, leading across sectors, geography, national boundaries, cultural boundaries, in order to integrate people, resources, and organizations in semi-permanent arrangements to achieve the common good. And we really think that this is the kind of leadership that is required to tackle complex public problems, social needs, and opportunities. Now, the good news is that as we have worked on integrative leadership, we've found plenty of examples of this kind of work from local to global levels. And the bad news is that we still need much more of it, as I'm sure many of you are aware. And so today I'm going to be concentrating on just a few examples of people leading across national boundaries, since we are focusing on global leadership, as well as leading across sector boundaries and cultural boundaries. So the first one I'm just going to mention very briefly, and this one is the global initiative begun in the 1990s to combat the exploitation of children in sex tourism around the world. Maybe you recognize this woman. This is Marilyn Carlson Nelson. She and Queen Sylvia of Sweden are among the very prominent leaders in this effort. Marilyn Carlson Nelson at the time, was CEO of Carlson Companies, which is a major travel and tourism industry company based here in the Twin Cities. And she and the Queen worked with a lot of NGOs and tourism organizations to promote a code of conduct for hotels and other parts of the tourist industry to agree to combat sex tourism involving children. And the reason I cite Marilyn Carlson Nelson in addition to this effort is that she really was a major source of support and inspiration for starting the Center for Integrative Leadership. It was her call for integrative leadership by business people, nonprofit leaders, government people to tackle public problems that like human trafficking, that really got us started. And then I want to mention an example focused on HIV/AIDS, which is certainly one of the public health challenges today that all of us must be concerned about. Perhaps you've heard of the book Mega Communities. Maybe you've looked at that. Anybody know about this book? Booz Allen Hamilton executives put this together based on some of their experience, and they cite quite a few examples of integrative leadership at the global level in this book. And the one I'm going to focus on involves HIV/AIDS in India. And the beginning of this was Booz Allen Hamilton and two other business groups, the Global Business Coalition on HIV/AIDS and the Confederation of Indian Industry, brought together numerous stakeholders. They got business representatives together, local NGOs, people from the Indian departments of health, the military. They invited WHO. They had the Gates Foundation involved. They had people from USAID and the U.S. Department of Health and Human Services. They had community workers involved. So a wide array of stakeholders. And they brought them together and had them engage in a strategic simulation about how to combat the spread of HIV/AIDS in India, and divided people into teams representing major stakeholder groups. And these people argued with each other. They tried out various ideas for how to combat AIDS, and eventually came to the conclusion that fragmented solutions just wouldn't work. And so eventually they began to think far more comprehensively. And the result of this was 100 initiatives in which businesses provided facilities and funds to promote AIDS prevention in the workplace and in communities. NGOs began to pool their resources. Governments began, the national government agreed to push more autonomy to the local level, and at least one Indian drug company partnered with NGOs and some global pharmaceutical companies to provide low-cost HIV/AIDS drugs. And so I think this is an important example as well. And then finally, I'm going to focus on Rotary International's PolioPlus campaign and use that to talk about the integrative leadership practices that have emerged from the kinds of research that several of us have been doing over the last several years. How many of you remember the polio epidemic in the U.S.? Okay, just a few hands. I certainly remember it, which gives away my age, I suppose. It was a scary era, right? And what a relief when a vaccine was developed, and beginning in the 1950s and onward, U.S. children could be vaccinated against a very debilitating disease. But we all know that this did not eradicate polio worldwide. Polio persisted in many countries, particularly countries we often call developing countries. And so I want to focus on a very major response to this that was developed by Rotary International. And I have the web page, their homepage up here today. Are there Rotarians in the audience? One, two, three. Well, you know that Rotary is a worldwide organization of professionals and community activists who are dedicated to humanitarian service. 1.2 million members in about 33,000 clubs around the world. And starting in the 1960s, this now century-old organization began to really consider the international part of the Rotary name. Presidents began to advocate a process of pairing up clubs in the so-called developing world and the more developed world, I guess you would say. And the upshot of this was many transnational service projects and exchange opportunities. Well, then in 1979, a Rotary member, a physician named Robert Hingson, really wanted Rotary to use its vast resources to get involved in immunizing children. And, you know, a lot of physicians and health professionals are active in Rotary, so this kind of made sense. And the board agreed to start a pilot project in the Philippines where polio was certainly endemic, very high infection rates. And they worked with the Ministry of Health, with UNICEF, with WHO, to launch an ambitious, focused project in the Philippines. And it was very successful. Something like 90% of the children under age 5 were immunized in this campaign. And that success then prompted Rotary to go ahead and undertake similar projects in other countries. And then in 1985, Rotary had a process of soliciting suggestions for a new kind of major initiative. And one of those suggestions came from a Rotarian named John Seaver, who was an official with the National Institutes of Health in the U.S. And that suggestion was to begin a 20-year campaign to not just immunize kids, but to wipe out polio around the world. You can imagine that that prompted a lot of discussion, deliberation, and debate. But eventually, the Rotary Board said, yes, we can do this. And so they began partnering again with some of these international organizations like WHO, UNICEF, and announced that they were going to begin this. They spent the very first year simply educating their own members about the issue and about the campaign. They also began training workers to carry out the actual projects and also organizing fundraising, which was very ambitious. But believe me, they didn't have a clue at that point how much it was going to cost. Eventually, they would help raise $3 billion for this campaign. Around 1988, WHO announced something called the Global Polio Eradication Initiative, and this was a partnership with these three main partners that I've already mentioned: UNICEF, WHO, Rotary International, and also the U.S. Center for Disease Control and Prevention. So all of those partners got involved. So I just want to let you see for yourself one example of what this is all about. So just bear with me one moment.
Since the mid-1980s, Rotary International's PolioPlus program has fought to eradicate polio worldwide. Working with its partners in the Global Polio Eradication Initiative, raising and deploying hundreds of millions of dollars and relying on tens of thousands of tireless volunteers, the international humanitarian organization has helped immunize more than 2 billion children. Polio cases have declined more than 99%, and the number of polio endemic countries has dropped from 125 to only 4. One of those countries is India. But even here, with a population of 1 billion people, fewer than 1,000 new cases are reported each year. Many occur in the state of Uttar Pradesh, where population density, malnutrition, and poor sanitation lead to chronic illness. Under such conditions, children need extra doses of the polio vaccine.
They used to say that 3 doses of the vaccine are enough. In southern India, they found perhaps 7 were enough. In other parts of India, the number went up to 12. Here in UP, perhaps even 17 or 18 is not enough.
The government's immunization program needs additional support.
These kids tend to contract polio because they've not received the birth dose or the doses thereafter.
So, just want to, before we start focusing on the leadership practices, mention some of the outcomes of this campaign. Part of the footage here is of something called a National Immunization Day, which is used in numerous countries in which Rotary has overseen this campaign. And what you saw here in India represents an effort periodically to establish throughout an area such as Uttar Pradesh something like 650,000 immunization booths. 3 million volunteers get involved. 150 million children are immunized in one day. And those children that do not show up at the immunization booths have a chance to get the vaccine because teams of 2 or 3 people go house to house. And so, obviously, as you saw in the clip, this is a very challenging disease to combat in India, but a lot of success has occurred. And so, as of 2005, the Rotary anti-polio campaigners realized that there was still a lot more work to do. And so they decided to keep going. And so these efforts are still going on in many countries. But as you heard in the video, already there has been an incredibly successful effort to drive down the polio infection rates. And so in 1985, when this got started, there were 360,000 cases of polio reported. In 2009, 1,600. So we can see really the impact of this, but the importance of continuing to get rid of those additional cases, which can be quite challenging in these 4 remaining countries of Nigeria, India, Pakistan, and Afghanistan. So now I want to talk about these practices of integrative leadership, practices that people who want to take on challenges, maybe not quite as massive as polio, but who recognize they've got to lead across sector boundaries, across cultural boundaries, across geographic boundaries, and often professional and disciplinary boundaries. So I want to talk, first of all, of course, it makes sense, about getting started, about coping with the initial conditions. And so one of the initial questions to ask is, how do we shape and take advantage of windows of opportunity? And this requires recognizing whether conditions are favorable. Are the economic conditions, the social conditions, the political conditions, ecological, technological, or do we work on making those conditions favorable? And then can we make the problem or the need or the opportunity visible, urgent, get across the magnitude of it, the importance of it? Can we do that? And then third, does our organization have the capacity to collaborate? And what about our potential partners? Do they really have the capacity? And I think in the case of Rotary International, they had really built the capacity through these years of trying these various immunization campaigns. They now had substantial capacity to carry out something as ambitious as eliminating polio. The technology was there for delivering polio vaccine, although it had to be modified, of course, to kind of adapt to conditions. And they also were able to take advantage of milestones, like the 100th anniversary in 2005 of the founding of the organization, to aim for this really ambitious goal at that time. And they announced the campaign at the 40th anniversary of the UN. And so thinking about how to both take advantage of and shape windows of opportunity, absolutely important. The second piece is building these strategic cross-boundary relationships. And just about every successful collaboration that I've studied really rests on a foundation of relationships, positive relationships. And so one way to develop a sense of where you need to build those crucial relationships is to do extensive stakeholder analysis and involvement. And clearly, Rotary leaders were very adept at this. Of course, they had that million or so members that they had to think about. They had to think about the clubs. They had to think about the governments of the countries they were involved in. They had to think about all of the health professionals they hoped to win over, and all those officials in international organizations that had a very clear stake in this and had their own perspectives on what to do. And so both figuring out ways to identify who these stakeholders are and get them involved is really crucial. And then the third piece here that I want to highlight is what I call deploying personal assets on behalf of the leadership work. And so here, the two types of policy entrepreneurs that I want to emphasize are people we call sponsors and champions. Sponsors are people who have a lot of formal authority that they can draw on to provide legitimacy for an effort, staff, resources, money. Resources, of course, cover money, but there are many kinds of resources that are in addition to money. And that would be people like the presidents of Rotary over these years. And then there are the champions. They draw on informal authority to provide the persistence and the energy to both advocate for some initiative like this and also to see it through. Usually some major project like this is going to have many champions along the way. And so I want to emphasize the importance of both of those. In this case, I mentioned Dr. Robert Hingson, John Seaver. They would be good examples of champions. And so this is a lot of getting started. And then focusing on integrative process. And this is needed to build bridges, to build inclusive and functional structures, to plan effectively, and to manage power imbalances. And the first thing that I want to emphasize is the importance of designing forums, designing and using forums, the settings in which people can come together and share their different perspectives, argue with each other, develop a sense of common ground, and agree to do something. And so, obviously, today we're here in a forum, but they can take many shapes. And the practices that go on in these forums include inclusive convening and consulting. And certainly in the case of Rotary, you see many examples of this. Leaders convened committees, task forces, international conventions. They met with these international bodies that I have mentioned. They had behind-the-scenes meetings as well as the public meetings. They met with village councils. They had media events. All of these things are really important. And then in addition to that, the work of nurturing dialogue and deliberation, framing and reframing, and inspiring vision. I just want to focus on the framing piece, which I think is so crucial. The Rotary reframed itself as a transnational organization from its beginnings as an organization of loosely connected service clubs around the world. And so that was a crucial piece for this. As people debated whether this polio campaign was a good idea, some people approached it from a public health perspective, others from a children's human rights perspective, still others from a medical perspective, others from a child development perspective. The frame of public health certainly won out, but it could certainly embrace all of those different perspectives. So looking for that unifying frame, I think, is really important. And then finally, the inspiring vision piece. What could be more inspiring, really, than the possibility that you could actually eradicate polio, or certainly drive it down to these extremely, minimal levels. So then the third piece here is allowing a shared understanding of the common good to emerge, which I think in these kinds of efforts is far more effective than starting out with some idea of what the common good is all about and then trying to impose this on the people who might be partnering with you. And so I promised to talk about essential elements of the common good, and I identify three. And the first one is thinking about whose common good motivates us to undertake this work in the first place. And clearly, in the case of the Rotary example, this was the children of the developing world, their families, their communities. And I think Rotary had that very clearly in mind. And then second, what's the content of the common good that we're seeking? And in this case, very clearly it was the rights of children to healthy lives and the attendant benefits that this would have for themselves, their communities, and their countries. And then third, what's our means of achieving the common good? I certainly think there's a lot to be said for the active involvement of the various stakeholders in shaping the vision and in then carrying this out. And we clearly see that in something like the National Immunization Days in India that I was talking about earlier. A couple of other things connected to integrative process, and they are influencing policymakers, whether it's in government, it might be the policy boards of nonprofits or of these international organizations that we talked about. It might be the board of directors of businesses. And so having very organized plans to focus on those people who can control the policies that are going to affect this effort, really crucial. So I've mentioned several times that the Rotarians focused on working with the people in government in the countries that they focused on to try to get the acceptable approvals that they needed, and also worked with these international organizations. But they also had to think about their board, keeping their board very supportive. They had to convince companies that they wanted to help them provide ice. They had to get those village councils to be supportive, and they had to influence heads of household to bring their kids to the immunization booths or accept the vaccine when they came to their houses. And so focusing at multiple levels of decision makers is really crucial. And then the last practice in process that I'm going to focus on is this work of enforcing and reinforcing principles, laws, rules, and norms. And here the critical things, this will be in formal and informal courts. Rotary, for example, had to make sure that they were abiding by the laws of these countries that they were working in. They had to be sure they didn't transgress too much the rules of these international organizations that I talked about, and they certainly had to be extremely sensitive to the norms of the countries and the communities that they were working in. And so I always want to highlight that. In addition, of course, they had to have mechanisms in place to make sure that funding wasn't getting diverted, vaccines weren't being misused, so they needed to do that too. And then integrative structure. One of the things I mentioned that was important to think about in those forums early on is to think about what structures do you need to help you carry out your work. And integrative structures help bring diverse groups together. They provide governance for the collaboration, and they also help you implement the decisions of the collaboration. And so what's needed here? Well, creation of inclusive governance structures. In the case of PolioPlus, Rotary set up a very complex global committee structure that's functioned quite well. You don't always have to have such a complex structure, but you do need to have some way of setting policies for the collaboration and overseeing their being carried out. By the next piece of structure, which is these action groups of people who have the needed skills, contacts, and so on to actually carry things out. I think, again, you can see that in the example of the National Immunization Days. So those are two pieces around integrative structure. The final set of practices I want to mention are related to outcomes and accountabilities. So getting together and coming up with a wonderful vision, an action plan, getting those supportive decisions from policymakers, reinforcing the rules, norms, and so forth, and changing some of those, those are all fine and well, having the appropriate structures, but unless you get the outcomes right, you will be still not accomplishing what you set out to do in the first place. And so our research indicates that successful collaborations have systems in place to assess outcomes and manage for results. And in the case of Rotary, they had to work with epidemiologists and others to make sure that they were actually making the kind of progress they sought. They got a lot of evidence that they were, but some evidence, of course, where they were failing at that. Connected to this is the need to publicize your successes. And so the results that you get can be publicized in order to keep people energized, keep raising those funds, and retain your legitimacy. So linking work on managing results to publicizing those results is often very important. And then finally, reassessing and staying resilient. So 2005 came around for Rotary, and they had to acknowledge that they hadn't quite made it. And they really had to summon a lot of resiliency as a global network to say, okay, I guess we can raise a few more $1 million. I guess we can keep those volunteers going. And so this is another important component. So this really wraps up most of what I wanted to say to you, but I want to give you a chance. I promised that you would get a chance to think about your own work and how you might be sponsors and champions yourselves. Now, I recognize that maybe none of you are queens or CEOs, but perhaps you're in a formal leadership position that enables you to provide legitimacy, staffing, money to help people tackle some complex public problem that needs leadership across various boundaries. at the very least, I think you can be a champion who provides some of that energy, persistence, determination, understanding of process in order to get something started and to help keep it going. So just for a moment, talk to somebody near you about this question. What do you care about that might require integrative leadership? Well, I'm very happy to hear this buzz around the room, and I hope our viewers have found some people to talk to as well. Let's return to just a little bit of wrap-up here. I just want to say that I hope I have provided some good examples to you of what global integrative leadership might be all about, that you've got some ideas for how to get started with global integrative leadership and some notions of why integrative process and integrative structure that are so connected to each other are important and what some of those elements are, and then the need to focus on outcomes and accountabilities. So I look forward to hearing many more examples of global integrative leadership as we talk now among ourselves and with the panelists. So I'm ready to turn it over to the panelists.
Thank you, Barbara. As I mentioned in our introductions and welcome, we'll take about 5 minutes in order to reset and bring our panelists forward as each of you write down questions that you might have that you'd like to give Barbara or the panel, and then our staff will pick up those questions here in a moment. So I would like to invite our panelists to come forward as we get organized. And Barbara as well. This is a test to see if they know their own names, right? And again, it's my pleasure to be standing here next to colleagues and friends in this activity today. And I want to give a short introduction to each of them as we continue to collect the questions. As I think through their discussion and through answering some of the questions that we all have, you will get to know them even better. But next to Dr. Crosby is Dr. Joanne Dish, who's a clinical professor and director of the Catherine J. Densford International Center for Nursing Leadership and holds the Catherine R. and C. Walton Lilly Hyde Chair in Nursing Leadership at the University of Minnesota School of Nursing. She was also a founding member of the Center for Integrative Leadership and served on several cross-sector boards. The AARP as board member and chair, the National Center for Healthcare Leadership, and she continues her research focus in nurse-physician leadership to improve care of patients with CHF. We have sitting next to Joanne is Dr. Will Houston. Dr. Houston holds the Endowed Chair for Global Food Systems Leadership as a professor in the Center for Animal Health and Food Safety at the University of Minnesota. And he directs the Global Initiative in Food Systems Leadership and is faculty appointment at the University of Minnesota College of Veterinary Medicine and School of Public Health. The GIFSL program, which is the Global Initiative in Food Systems Leadership, develops and delivers professional skill building and leadership development programs in collaboration with an international consortium of universities, government agencies, intergovernmental organizations, and the private sector. And to Dr. Houston's right is the Dean of the GPS Alliance, the Global Programs and Strategies Alliance of the University of Minnesota system, where she promotes global dimensions of teaching, research, and engagement across all colleges and campuses of the university. Meredith McQuaid has a large role in all international activities that we partake in research, in teaching, and engagement across the world. She holds an adjunct faculty position and teaches Introduction to American Law and Legal Research and Writing for Foreign Lawyers. So as you see, we have a group of panelists who cut across several sectors here at the university, bring to you views and experiences in many different contexts around the world. Now, we have posed several questions to our panelists in preparation for today, but I want to take the lead in posing first the question that Dr. Crosby gave us and get their impressions on what you care about that would benefit from integrative leadership. What do you care about that would benefit from integrative leadership? And Meredith, would you like to respond?
Sure. Do I need to use it? I guess I do. Well, I think that what I care about are many things that would benefit from integrative leadership, but particularly within my role, the idea that there is a central office that can coordinate international activities, not only across the Twin Cities campus, but across all 5 campuses. That's my job description. And it's daunting, to say the least, particularly when the rest of the university wasn't informed that that was the role of my office. So it's been a process of building partnerships, finding both champions and formal authority to support the activity, because our work internationally, the work of faculty, students, and staff across all 5 campuses is international. But the idea of weaving the activities together in a way that reflects a strategy is the challenge. And so what I care about is accomplishing that challenge, being able to represent the University of Minnesota as a global university, one that is acting according to a plan, that we're marshaling our resources and we're doing it well and we're accomplishing goals. So that's sort of the overarching theme, and then the idea is how do you accomplish integrative leadership to achieve those. And much of what was presented today is how myself and my staff have been working for the last 4 years, because the office is pretty new, at least under the current regime, it's pretty new. So I don't know if that directly answers your question, but it's I care very deeply that the rest of the world knows how internationalized the University of Minnesota is, and that we're able to tell our story well, and that we're actually able to accomplish many, many, many of the things that our faculty are doing and are extremely capable of.
And as Meredith knows, and my Dean Finnegan says, we are truly a global land-grant university as we move forward. Dr. Houston?
Well, Deb, everything I care about benefits from integrative leadership. I guess my whole career has been one continual, how should I say, journey of revelation, as I recognize that this whole concept of positional leadership is simply not well aligned with tackling the complex challenges we face. These challenges that some might call wicked problems or grand challenges or social messes. There's no individual, there's no discipline, there's no organization, there's no country that has all the insights in order to make incremental progress. And the challenge we have often is that we characterize the problems in a way that makes them, we make them static in order to describe them, but they're constantly moving. And all too often I find that the challenge that we're trying to tackle has changed by the time we get our act together well enough to try to take action. So I think integrative leadership is the strategy that is the future of whether it's the university or future of us as we want to make the world a better place. We've either got to do it together or we'll all fail alone.
Well, this will be nicely complementary, but a little bit different, I think, in that I think integrative leadership is a lens that leaders and others use to look at every situation. And by that I mean it's an inclusive, it's the recognition that an individual, a country, a vendor doesn't have the answers and needs to partner with one or many or several to get a solution that is going to improve something. The definition we use at our Leadership Center is very simplistic, but we think powerful. Working with and through others to improve something. And so integrative is just foundational to that, because we know leaders can't work alone. But the point being that integrative is a lens that some people use and frankly some don't. And so we sometimes have to drag people kicking and screaming. My particular passion, having been a nurse for 40 years, is the healthcare team. And how do we make sure everybody's voice is heard? Not just the surgeon, but the anesthesiologist, the nurse, the physical therapist, the social worker. So that's my local application. The final comment I'll make
parsing the phrases, integrative leadership and global, is what does global mean? Because our students would dearly love to have an international experience, so I'll follow up, but they can't for a variety of reasons. So how do we make it local? How do we make global local? And a couple of examples I think have been fascinating to me in the last couple of weeks. Our very own West Bank, there was a picture in the newspaper of two women from the Hmong culture and an American Indian woman walking down the street a week or so ago on our very own West Bank, showing solidarity because they were having a crisis in those communities of the Hmong and American Indians not being able to work together to connect. And so how do we bring those groups together? One of the most powerful partnerships we have on our campus, has international, global overtones, but is between vet med and nursing. And when I first heard about this partnership, I was like, vet med, the horse whisperer or something like that. And actually it makes profound sense, and it's global and it's integrative and it's leadership, but there's an integrated team with colleagues from public health to take a look at the transmission of infectious disease between animals and humans and animals. And what a neat focus for work. So in answer to the question, my personal application is how nurses and physicians work together to take better care of people who have congestive heart failure. But the application, I like to keep local in my global thinking so that I can do something about it. I don't know that I'll influence global affairs as much as I can do things here in an integrative way. So that's my passion, is to make global local and local global.
And Barbara, we heard of several examples that you brought forward, the HIV, AIDS, the polio, sex trafficking. Are there other programs that have fed your passion to answer this question other than the examples that you brought forward today?
Well, I can certainly cite other examples. The one I will focus on for a moment is the founding of the Center for Integrative Leadership and this effort to bring people together from the various components of the university to both think about together how we view leadership and leadership development. But also just this effort to build the center itself was an act of integrative leadership. And we did have formal sponsors who endorsed it and couldn't have thrived without that. So President Brunix was a very strong supporter. Provost Sullivan also. I mentioned, of course, Marilyn Carlson Nelson from outside. She's been a strong philanthropist who has contributed a lot to the university, both in terms of her philanthropy and also kind of her vision of kind of the public outreach side of the university. And let me tell you, it wasn't always easy to bridge among these different groups. The Carlson School, maybe some of you might suspect, has a rather different culture than the Humphrey School of Public Affairs, just to cite two of the major partners here. And we had to learn to recognize those differences and build bridges between them in order to have a successful center. And so I continue to be passionately committed to further work with the Center for Integrative Leadership. I think now under our Executive Director, Laura Bloomberg, and we have new faculty involved as well. Maybe I can step back a bit. I took advantage of sabbatical to do that. But that would be a prime example for me.
Thank you. Our passions play out in different places and in different ways. I think it does much for leadership in general to be true to those passions. So thank you. Since we have several questions from the audience, why don't I turn to these questions, and please, anyone that might like to address them. How does, this is a tough one to start with, but it was on the top of the list. How does one handle individuals that try to sabotage your efforts in integrative leadership? Anybody want to address that one?
You make them part of the team. Have you ever read what's the book about Lincoln's Cabinet?
Three Great Men.
Yeah.
Team of Rivals.
Team of Rivals.
And it's a fascinating thing that I think, in fact, I think we all benefit from from critics. We all need a healthy skeptic in there to keep challenging us. And one of the great opportunities is to simply embrace their challenges as part of the benefit of having this integration across multiple disciplines and bring them to the table.
I think a related thing to that, bringing them to the table, the first thing is to sit down and really understand what their mental models are. I've had experiences where, and I share the story, but when I was interviewing for the AARP board, there was a current board member who obviously did not like me at all, did not know me, but his whole face was just hostile. And he asked me a question, and I was trying to think of an answer, so I said, well, that's a good question. And he lunged at me and he said, I don't care if it's a good question, I want a good answer. And I was just like, whoa, there is something going on here. And so, fast story, I spent time learning from him, understanding why he was so angry, what the issue for him was, totally unrelated to me personally, which I suspected since I didn't know him, but to really understand where he was coming from. And he had some mental models of my background that weren't true. Fast forward to the end as he became a mentor. And I learned so much from him because he thought so differently from me. It took me a while to get over his initial lunge and then spending time talking. But I think then I could, and we were on the same team. But, there's nothing more fun than sitting with people who think just like we do. But, I've learned the most in my career from people who I was bitterly in disagreement with and just thought, where are you coming from? But circumstances required me to sit down and learn from them, and that's what I think is the important step.
Seek first to understand.
Exactly, and then invite to the team.
Well, I agree with exactly everything you've said and have had similar experiences myself. At the same time, my immediate phrase that came to my mind was, buy them out. In other words...
That's like Carlson School coming out.
I've had to learn. But what I'm thinking about is find out what is the interest of this person or stakeholder group, and be sure that somehow your initiative recognizes that interest, which may not be their position, but rather what is it that will draw them in and keep them engaged. Now, I also am an advocate of sometimes letting people go. It is not always possible to involve every last single person. Certainly not now. It might be possible later on. But I give teams in my classes permission to fire their team members if, it just won't work in the time frame we've got. So I do think there are times when you have to realize that a particular person or a particular group cannot be involved in a productive way.
Well, and I think particularly when you're starting out, if it's something new, it can be a waste of energy to try to persuade everyone simultaneously. So you build your coalition and then circle back around. There's just some people who are just, people who say no. And what they want is to join a winning team. And so if you can get some wins and build your team with people who are so inclined, you will find that the people who originally weren't interested or thought it was all for the bad have decided it is actually all for the good. So you can come back around and pick people up later.
Thank you.
So, Deb, do we get to ask questions of the rest of the panelists?
I think all's fair.
Thank you. Great. So,
Can we take a vote?
Right.
You know what Joanne just said about inviting these veterinarians
That's right.
into nursing?
So we're teaching a course in Global One Health Leadership, which is really about integrative leadership. And one of the most powerful sessions we had was people telling their stories about what was their transformational moment. So the four of us grew up, the five of us, grew up in a country in which, in our childhood, if you'd said leader, we would have read JFK's what the book he did on leadership, and they were all, most of the role models we had were male. And most of the role models we had were people that had positional leadership. So they had occupied some position, and yet what we're promoting here is something remarkably different. So what was the transformational moment that allowed you to step, that really propelled you outside of this mold in which we were developed?
I'd like to speak first because that assumption about learning from white males didn't apply to me. because I was 12 years with the good Catholic nuns, the Dominican sisters, who are Jesuit, very intelligence-oriented. These were very, very smart, sharp, no ruler over the hand kind of learning. But they had high standards, and many of them had doctorates, and they just were very impressive in how they held all of us. It was a mixed co-ed high school and grade school, but very powerful role models about influence, about social justice, about giving us the gifts and the skills. So I do think I would agree with you. The point about how we are shaped earlier does have carry through. But I credit them a lot with setting a bar and giving us the tools to get to it, and the thought that, hey, whatever you want to do, you can do. So there were maybe many different learnings. But yeah, I'd be interested in what everybody else.
Well, I did not benefit from being educated by nuns. I grew up in Augusta, Georgia, in the segregated South in the 1950s, and remember having some powerful women teachers. I mean, this was the days, it's still somewhat evident now, that all the principals and superintendents and so on were male, and most of the teachers were female. And then in college, I had the reverse, which was I never saw a female instructor except in physical education. Never. But I had a great liberal arts education. I think that being in college between 1964 and 1968 in the South was quite a time of, let's say, political awakening, certainly for me and for many others. This was the era, of course, in which we invited people like William Buckley, Julian Bond, Martin Luther King Jr., Robert F. Kennedy Jr. to campus. And I was involved in getting some of those people to come, and was a journalist for many, many years after college, for 3 years working on the Augusta, Georgia Herald and covering questions like school integration, the beginnings of the environmental movement. And so I don't know that I've had a lot of transformational, just one of these kind of Saul on Damascus Road kind of experiences, but that being in that era and wanting to be contributing to a better South really affected me a lot. And I know it's true for you, Will, too. So maybe you can talk a little bit.
Well, Yarna can tell a story about being thrown out of the interview.
I had told Will about interviewing the school superintendent of Richmond County, Georgia, and asking him what he was going to do about the federal court order that said he had to integrate his teacher staff, and basically being thrown out of the office because I had quoted him saying he'd go to jail before he'd do it. So, but I can't remember. I don't think he went to jail.
Oh, mine's brief. I did go to Catholic school, and I did go with nuns who had the ruler, so I can't claim those as my role model. I'm from a very, very large Catholic family. My mother stayed home to raise us and did lots of things on the side. She had 8 kids of her own, but she brought in children to make more money to help the family income. And when I was in high school, she also sold Avon, if you remember those days. They made an effort to close our local school, so she got very involved in school board. And then when I was in high school, she ran for mayor of St. Louis Park. And so she has no college degree. She didn't really have any work experience, and she ran against the father of a classmate of mine. And it was mortifying, if you can imagine, to be 16 or 17 and have your mom running for mayor. And it was brutal, actually. I mean, it was incredible to watch her, and I remember feeling both terrified and very proud of her. But it was incredibly hard work. She won the election. She won it twice. She went on to the state senate. But just observing her and her courage, standing up to a lot of, particularly in those days, early 70s, there weren't a lot of women elected to positions of authority. So she did it all with a lot of persuasion, building her allies and circling back and picking up people who had been against her to begin with. So I would guess that's the best one.
As part of the 5, as you know, I think of leadership as a process and as a journey, and there have been a lot of opportunities in my life to see leadership in action. And I wish I could think of a different word than leadership, because we're using that term so many times in so many places. I'm not quite sure that we always know what it means. Barbara mentioned an individual who we at the university oftentimes think of as strong woman in leadership, and that's Marilyn Carlson Nelson, who just recently, when Laura Bloomberg and I were having lunch with some of my EIO, Engaging Intergovernmental Organization, women colleagues, it was brought out about her philosophy about being on a board of directors. And her philosophy was she would not sit on a board of directors unless there were at least 3 women. She called it the power of 3. And we started talking about this process, and it was if you have only 1, and I'm leaving off the word woman because it can be anybody. If you have only 1, you can be dismissed. If you have 2, you can be pitted against each other. If you have 3 or more, you can garner that power to do something in action. So whether it's women in leadership or global leadership, that power of 3 I will never forget, because that, again, was part of the leadership process that I will remember along the way. So moving on to other questions from the audience, because there are many that have impact on what we do with the problems of public health, global health, and leadership, and wicked problems. One of the questions, can you talk about the role of multinational, in this case medtech companies, in the developing world and advancing their interests and role of corporate philanthropy?
I can, sure. Since I spend a good part of my time in what some of my public health colleagues call the dark side, I work with a lot of multinational corporations, and it's proven to be a very exciting and rewarding part of my work. And it all goes back to what Barbara was talking about, and I think it's getting to the shared interest. I find, in fact, that, or have yet to find a company whose interest it is to make the world a worse place. I have yet to find a company whose goal it is to make people sick. And I have yet to find a company whose goal it is to impoverish the very people that work for them and buy their goods. So we have a good shared interest to begin with, because most companies, the multinational corporations, in fact, I'm going to go even further and go out on a limb here. I've worked for the national governments of the United States and the UK and advised a number of other national governments, and from my own personal experience, I think that multinational corporations, the ones I've worked with, come closer to thinking globally and acting locally than most national governments. That I find many times national governments are acting within a very narrow window of their own self-interest, while multinational corporations are really looking at global interests. So to me, it's a window of opportunity. You used that term as well. And the key is to find then, if you will, something small, some small activity that essentially has a strong value proposition for both the multinational corporation partner and the other partners in this integrative leadership. I think it's a remarkably untapped opportunity for integration and leadership. I'll make one other comment for those, I'm sure that there are those sitting out there that maintain their skepticism. And the one other comment I'll tell you or share with you is that, government alone cannot address the challenges we're talking about. Neither can the private sector alone. Neither can the non-governmental organizations alone. In fact, I think the only way that we can make significant, really radical improvement in most of what I see as the major public health challenges facing us today are through some type of collaborative strategic partnership using this integrative leadership model.
I'll just make a quick comment. We've had some discussions at the center, the Leadership Council, about we could start in our own state in terms of finding common shared goals, and if we could do anything to advance the discord or the discussion among people of different political parties, we would have done world good if we could do something to that, applying these principles in our own backyard.
The one thing that occurred to me was, I mentioned the example from mega communities, and the HIV/AIDS focus in India really was part and parcel of business interests in India. They didn't want a workplace where workers were really threatened by HIV/AIDS. And so I think most corporations, the bulk of corporations do get involved in this work because it directly affects them in some way. A drug company, for example, with, perhaps these drugs that are either too terribly expensive, or the disease is not widespread enough to merit the research and so on.
The river blindness.
Yeah. And so we have some really good examples, I think, of businesses that not always have been, absolutely eager to give away drugs or develop the drugs that are needed, but recognize that it's in their interest to get involved and try to work something out.
As we're talking about private enterprise, and you bring up about the drugs, there's a question here, a long one, and ask me to paraphrase, and since I'm not always accurate on paraphrasing, please bear with me as I read it. Dr. Crosby focused on the campaign to eliminate polio in part of her talk. At the very beginning of that process is vaccine development. Are there collaborations here at the University of Minnesota between and among basic science researchers who have made important discoveries necessary for vaccine production with public health professionals, physicians, and non-profits in business to make vaccines today that make sense for those in developing and more developed countries?
Boy, I think that's a great challenge for us. In fact, I'll go further. I think that there's an untapped potential at the University of Minnesota. University of Minnesota is pretty unique. It's one of the most comprehensive universities in the United States. It's one of the largest public universities. And yet we have a wealth of untapped potential, and part of which was shared with me 2 weeks ago. I had one of those moments where I'm blinded by a flash of the obvious, and that was we had the chairman of plant pathology on campus speaking about One Health leadership, or One Health partnerships, and she made this observation that was really struck me. She said, in plant pathology, we develop vaccines, we do diagnostics, we do all types of work on the same types of organisms you work with in veterinary medicine and they work with in the medical school. Why can't, and she said, and here on the St. Paul campus, some of our faculty are among the world's leaders in developing of diagnostic tests for fungal diseases. Why aren't we working? Why can't we build partnerships between the medical school, the veterinary college, the agriculture school? I'd go further than that, the immunology, in the basic science immunologists, to really move forward on this idea. I think it's a huge potential that sits there and is untapped, and I think we're uniquely positioned to move that forward.
And as we're talking about One Health, I think you answered this question, but I want to bring it out for the guests in the audience. Should One Health move beyond the health professions to address the integrative issues facing One Health from a non-health sector? How should they do that? And just so we're all on the same page, maybe a definition inclusive of One Health.
Can you read that again, Deb?
Should One Health move beyond the health professions to address the integrative issues facing One Health from a non-health sector perspective?
Yeah, well, obviously, I'll go back to that same example. There's a group on campus that's working on wheat rust. And talk about a vaccine. We tend to think of a vaccine as something you give a shot in the arm, or they were dropping the vaccine in the mouths of children. But, we now have these wonderful genetic tools. And we used to do it by plant breeding, but now we can do it. We can use some biotechnology tools, and we have a group on campus that's developing strategies to identify and protect against wheat rust, and basically to protect one of the major staples of the food supply for the world. Now, typically we don't think of horticulture or agronomy as part of the health team. In fact, in the University of Minnesota, we have two silos. One's called the Academic Health Center, and one's called the rest of the university. And yet I think those issues are as germane to global public health as any of the issues we work on.
Well, and go ahead.
You first.
It'll probably take it off topic a little bit, but the idea of just access, access to health care or food safety or vaccinations is a human rights issue. And so there's a lot of the discussion that goes on at the law school that could be connected to the One Health or the public policy discussions. And all of these things are linked, of course, all over the world. But, of course, within the university, we do tend to, I think we're breaking out of our silos more and more, particularly with initiatives like One Health. But, of course, these are all related in life as they should be in research.
Well, I was going to add, too, that I think pretty much everything leads back to health. And I think there is some effort now with the Academic Health Center to broaden it, because it was for many years, 6 mini silos in the academic health silo. So there is work to broaden the concepts of what contributes to health. So some of the other sciences and education. I'm always reminded when we have discussions like this, when I was on a study tour to the Netherlands, they conceptualize it very differently, i.e. health is not the traditional health professions. The woman who was the head of what would be the equivalent of our Health and Human Services at the time, about 3 years ago, was the director of health, welfare, and sport. And they conceptualize, and she had all of the professional sports teams, much smaller than ours, but the professional sports teams and youth exercise and playground programs and all those things. But she had health, welfare, and sport under her jurisdiction. They have a very different mental model of what constitutes health and what needs to be integrated. So in that same spirit, if we think about One Health really broadly, I think we could accomplish a lot more.
The one example I thought about came out of a team project in my Transforming Public Policy class in the spring. This group was focused on the educational achievement gap between Caucasian white students and students of color, and the incredible persistence of this achievement gap, particularly in Minnesota. And they ended up focusing a lot on comprehensive health initiatives aimed at high schoolers in particular, but also all K through 12 kids, because they found that health correlated a great deal with one's school achievement. And so I think the connections run multiple ways here, and many public policy issues have this health aspect.
In fact, at the risk of going, back to the future, in 1946, when the World Health Organization was established, they came up with a definition of health. And it's a sobering definition because I think we've forgotten it. And it says, really, health is the state of complete mental, physical, and social well-being, not merely the absence of disease. And yet, largely, professionally, we've come to define health in much of the Academic Health Center as disease-related. So in my work, and to emphasize what Barbara just pointed out, whether it's human health or animal health or plant health or ecosystem health or societal health or economic health, they're all interdependent. We cannot assure the health of the population in the face of poverty. So we've got to look much more holistically, and I think that really says that this One Health ideally is something that the whole campus embraces, just as Meredith was pointing out, so it pulls in every discipline across the campus.
And as public health calls it, the social determinants of health, which is inclusive. I'm going to go to one of the questions that we posed to our panel to contemplate, because I think it follows this theme. One of the greatest health threats around the world is armed conflict and terrorism. Where are the global integrative leaders we need to foster a world in which differences are resolved in a nonviolent manner? One of the greatest health threats around the world is armed conflict and terrorism. Where are the global integrative leaders we need to foster a world in which differences are resolved in a nonviolent manner?
Well, I think they're right here. One of the things, just to go back to the very basics of internationalizing a university, is about student mobility. And the U.S. is known for decades, generations, that having students learn about one another's culture by living there, by going to school with them, is one of the most persuasive and successful transformational acts of diplomacy that there is. And so I think it has to do with thinking about who will become the leaders, who will be in positions of determining whether we're going to fight, we're going to oppose another group with force or with dialogue. And I think allowing people to get to know each other in settings that are different than what they see in the media, having students come here from other countries and get to know us as different from our government, having our students study other places so they get to know people as different from their government, is really, really powerful. It's something we happen to do very well here at the University of Minnesota, but we can always do more and we can always do better. But I think it's truly one of the steps towards global peace is multicultural, cross-country understanding.
I think the only piece I would add, and I think you would totally, although you may say no, but I think you would agree, there are graduated steps to be able to do that. And I think, again, if I look at our Phillips-Powderhorn neighborhood, if I look at the West Bank, if I look at a lot of places here in the Twin Cities, we don't have to wait until, as we say, we're going across the water to have those experiences, because that makes it sort of distance. And when I go there, I mean, what can we do tomorrow in our communities to create these little relationships that bubble up? And in the process, we learn differently. Some of the things that we do at the school, race and ethnicity and cultural differences are very powerful, but how we treat people who have a different sexual orientation, how we treat people who think politically differently, I mean, all around us are these opportunities to really start to appreciate and have practice with, so that then we grow up to be more effective. So,
Actually, can I just respond to that?
Yes.
Because you mentioned twice, and they're excellent points. One of the things we are doing better at the University of Minnesota is realizing people have international experiences without getting on a plane. And so we try to do a lot of promotion. Not only a lot of international students come here wanting to know more about our indigenous populations, wanting to know about race relations, but it's also about our own students understanding those differences as well. We have relationships with the White Earth Tribal Community College, for example. And so there are ways for our students to have international experiences right here at home. And I think it's absolutely critical when we talk about student mobility. It is not necessarily require a passport. That it's about mobility crossing all kinds of barriers that were introduced at the beginning. So I appreciate the point.
Doesn't require a passport like that.
Yep.
Joanne, going back to your earlier comment, it's interesting that we have courses at the university in public speaking, but we don't have any courses in the university about listening. And I think this whole idea of listening to understand, to me, is a first step. And where we think about armed conflict around the world, my guess is that the majority of us really don't understand the roots of that and haven't listened to the various sides involved. And it's too easy to try to make it into a multiple choice question. What's the cause of the Middle East crisis? A, B, C, or D? When in fact, many of these situations are far more complex. And really, I think we can make great strides by demonstrating the respect to try to listen and really understand at a much deeper level.
Well, I would focus on 2 or 3 things, and one is having people gain the tools of conflict resolution, conflict management. We do teach some courses here in the university on how to deal with conflicts in a way that leaves everybody standing and respected and so forth. And I think those are very important and, need to be done far more broadly, and we need it in K through 12 education as well. So I would say that. Another piece I think is pretty obvious to all of us is that one of the sources of conflict often is poverty, poor health, terrible extreme disadvantage. It doesn't mean that a poor person is going to turn into a terrorist. I don't mean that. But I do think that people who feel completely cut off from the kinds of things that we think any decent life ought to have can be very susceptible then to, out of desperation often, picking up the gun or the knife or whatever. So I think that's a piece of it. I do think we have to acknowledge that we live in an incredibly militarized world, and with many incredibly potent weapons, and a lot of businesses actually make a lot of money, and governments, including our own, make a great deal of money out of exporting arms. And so, that's a reality. And I think, that's maybe the pessimistic side of me that says, that's heavy-duty stuff that affects us all. And, unless you're involved in those industries, you don't think about it too much. But, that's a piece that needs to be undone if we are to have a truly peaceful world that is more healthy for everyone.
Another interesting example of integrative leadership is the global campaign against landmines.
Mm-hmm. Absolutely.
Which has a fascinating and really had tremendous impact at
Mm-hmm.
country level,
Yeah.
much of the world.
Yeah.
And as many sponsors would like, when the panelists lead into a commercial, I'm going to take advantage of what Meredith just said about understanding our own nations within our borders. And as Barbara talked about some of the issues around violence, we are having 3 days from now, on May 27th, Suzanne Keplinger, who's going to speak to us on Shattered Hearts, the commercial exploitation of American Indian girls and women, here at the Humphrey Atrium. She has a background in international project development, domestic violence, and fundraising from a very local perspective. So global is local, and local is global. Continuing on that note, another question. How do you establish trust of perceived outsiders, especially in cultures that have experienced historical trauma? How do you establish trust of perceived outsiders, especially in cultures with historical trauma?
Well, I'll share the story that Barbara was hinting at earlier. I dropped out of college 4 or 5 times back in the days of the Vietnam War, and became a community organizer in the South. I grew up in the South, in the integrated South. Or actually, I grew up in the segregated South when they were attempting to integrate.
Exactly.
And so I went back to the South and was to be a community organizer, a civil rights organizer. And the first day on the job, I worked for a black lawyer, and the first thing he said to me is, "White boy, these are not your problems." It was a shock. I was this idealistic hippie that thought I was going to save the world, and the first thing he said to me was, "White boy, these are not your problems." And what I learned over the 3.5 years I was there was not only listening skills, but patience. And I also got some wonderful lessons in being non-judgmental. For people that have been in a state of trauma or distress for a long period of time, it takes a long time to build trust. You can lose trust in an instant, and building trust takes a long time. And I just came to accept the fact that it was perfectly normal, natural, and appropriate that they didn't trust me. And in fact, I had to earn that trust, and that earning that trust was going to take a long time, and it had to be incremental. So I think we just need to accept that it is appropriate behavior for many of those with whom we would like to partner not to trust us. And just start small and be incremental.
Yeah, the point that I was going to make was just, it feels trite compared to that wonderful story, but it is person by person, it is situation by situation. You can't, mandate trust. Now we're going to trust a whole group or something. So I think your point is excellent about it. Sometimes that is the way it has to be. And, just keep working and connecting and listening, and sometimes that is what it takes.
Well, a couple of additional pieces, I think, are finding out where those common ties are, because we're all human beings, and there are ties of family that we can connect to. I just love seeing Obama in Ireland, tossing a pint back and claiming his Irish roots. It's just great. And so food is a real commonality. I mean, I can go anywhere in the South and we like the same food because the sharecroppers who are in my background ate soul food. And so, there are always those things that tie us together. Or in the case of Rotary, they had clubs everywhere. And so that gave people an automatic connection through that. Or when we have international groups here at the university, they may just scream and yell at each other because their countries are at odds, and yet both of them might be a physician. And so they find that commonality. And so I think realizing that we always have something in common while being respectful, while listening, and thinking about the differences, having attention to those commonalities can help.
Bringing it back to you each as leaders. Question from the audience. What goes into your decision as a leader to determine the scope of the problem that you want to address? What goes into your decision as a leader to determine the scope of the problem you want to address?
Well, I think for me, there are two things. One is something that really ties to a core value, and one that I know, I often have thought of this, it's the flip side of what I dislike. So a core value is people who support the growth and development of others' spirits. And by that I mean the negative side is somebody who is spirit-breaking, who intentionally seeks to hurt another or diminish them or disparage them. To me is almost one of the worst things you could do to a person. So what makes me passionate are things that focus on sort of the human condition, is where that comes from. What can I do to help? A wonderful mentor of mine said to me, Joanne, you can see a million things to do, but focus and impact. And so that really influences my scope. I'd much rather be broad and diffuse, but I know that I'm not effective if I let those natural tendencies just blossom. So the focus would be on things related to the human condition, related to my nursing, I'm sure, and then focus and impact about what can I do and what can I do well, and what will make a difference. Might be a small difference, but what will make a tangible, sustainable difference. And so focus and impact would be the advice she gave me that I use a lot.
I guess I would add, that's a good description. I guess I would add sort of who cares, so what? That is, how many stakeholders are there? Is it something that just matters to me? Or is it something that matters to a greater community or a diverse community or a shared community? And who are those people? I take I'm not particularly a patient person in my personal life, but in my professional life, I spend a lot of time talking to people, various groups, partly because of my role, that I'm in this central office at a very decentralized university. So I spend a lot of time talking to people about what part of this do they care about? Do they care enough to support it? And maybe not. I have to convince myself that I'm willing to let go of things that perhaps don't have a strong enough base of commitment. And then I think it's identifying small markers. Milestones is too big a word for a small idea. The idea that you again, build allies, you find friends, you broaden your team when you can establish progress. And I don't think it has to be, billboard-sized progress, but you have to show you're moving in the right direction as you add people to the group.
Well, these things appeal to me too, and yet what I thought about right away was I like to do things that seem almost impossible, and or impossible for me at any rate, but things that I can actually see a way to get there. And so starting a mid-career degree program here at the Humphrey School was like that. It was an 18 to 20-year effort, but I and others could see how it could be done. And eventually, through some of the kinds of things Meredith was talking about, we managed to do it. The Center for Integrative Leadership didn't make sense in a lot of ways. But I and others could certainly see how it could be done, and we kept at it and got those sponsors and other champions. So I kind of like that. I didn't think I could ever write a book. I thought that was near impossible. Well, it does feel that way when you're in the middle of it often. But that's what draws me, in addition to it being something that probably needs to be done and things like that. I'm drawn to things that seem like pretty tough assignments, but I can see a way to do it.
Barbara and I apparently are related. I'm going to have to talk to her more after this. Any of you ever buy a 1,000-piece jigsaw puzzle? And when you dump it out of the box initially, it looks just like this hodgepodge of pieces, and you just don't see how they relate. Well, for me, my vision, what I want to do to change the world is the picture on the front of the box. And what I do is what Barbara described in her talk, and that is, I'm a strategic opportunist. I look for the chances to make incremental progress towards that large vision. And that may be 2 pieces in the middle of the jigsaw puzzle. It may be a corner. You ever get that rush when you get a corner and all of a sudden you get 3 pieces, 5 pieces in a row? So I think it takes, for me, it started with a vision that was implanted as a boy. My father was a civil rights organizer, and who really wants to who impressed on me that I could change the world. And you keep that vision, you maintain that focus, you grab the opportunity exactly as Meredith said. You take those little steps, those bite-sized steps, and you better celebrate the heck out of every step that you successfully take. And if you don't celebrate it for yourself, nobody else will. So you got to pat yourself on the back and just keep maintain the faith towards the picture on the front of that box. And I think each of us individually can make a greater impact on the world than most of us give ourselves credit. The greatest challenge I think we have is that the blinders that we have on what we can do. And in my own life, I've been absolutely amazed at the access and the potential we have to make a difference in the world. And I think each of you all can do the same.
And with that, please join me in thanking our panelists and Dr. Crosby. Just in quick summary, again, I'm very thankful to have global leaders at our university and in our health sciences and outside of our health sciences areas. We heard today that creating an integrative leadership environment means getting started, shaping and taking advantage of windows of opportunity, building strategic cross-boundary relationships, deploying personal and organizational assets on behalf of policy change. One of my passions is providing and designing forums in which these conversations can happen. And so I thank you for joining this conversation, and it will continue as the webinar will be available archived online in the School of Public Health website. So again, thank you for those who joined us in person today and those who are online, and I wish you all the best in your striving to reach a global good. Thank you.